who organizes this is, as you probably all know, the health policy program within the European Policy Center, which is kindly supported by an educational grant from Johnson & Johnson. It is now more or less a year ago I last saw the commissioner in person. I'm not sure you saw me, but I did see you because we were about 800 people in the European Parliament for the launch of the cancer plan. And we were sitting very close to each other, and nobody were talking about COVID or Corona, and we didn't wear face masks and whatever. So that was a good time, but it is not more than a year ago. It's actually a little bit less. And it actually shows how quickly agendas and the political circumstances can change. But it also means that we have quite a lot of lessons to be learned from the series of events that passed after that time. So we're far from over the pandemic, and we might therefore get further events, that we can learn from. But I think we already know quite a lot. And with the vaccine rolling out now, and thanks you also for the great effort from the EU for getting the vaccines in place, there's light at the end of a dark tunnel, and that has probably come with a much higher speed than any of us had hoped for about a year ago or when the pandemic started. And then in addition, I suppose we also now have to work on the learnings about how to actually improve the treatment of the patients for those that are sick and will be sick in the future. When we reach the end of the tunnel, we will also have a lot of delayed cases to deal with, things that haven't been done because of the pandemic, and that will put another or an extra burden actually on a health system that already before the pandemic was under pressure of reasons that we all know about. And therefore, I think the new black in health policy discussions these days is about resilience. How can we make our systems more resilient? And that means actually quite a lot. It means more robust, it means more flexible, and so on and so forth. But how can we be better prepared for unexpected circumstances? There's been some good reports coming out. The DG Santé's expert panel had a report coming out in the autumn, and I've seen there's a new one coming out also from the HSPA group about resilience, which is certainly something to work on and discuss and so on and so forth. But I think a lot of this can happen now with greater involvement from the EU than before. I was astonished, and having followed health policy in the EU for so many years, to suddenly see a budget of 5.1 billion euros now. It is quite incredible also compared to what we've seen over the last few years. So certainly health policy has moved up the agenda. And I'm just hopeful that we can make this budget to the best use for Europe, for the health systems in Europe, for the patients in Europe, for the citizens in Europe, and also to make us more resilient for future threats. And how this can be done is something that I hope the Commissioner will explain to us today or discuss with us. I've noted that there will be quite a lot of emphasis on preventing diseases in addition to curing diseases, and that is probably also an area that we need to work further on, which also, again, could add a lot of value to our societal economies and so on and so forth. So, with these few words, I just want to say to the participants that when you have questions, it would be easy for us if you could use the chat function and you could write them down, because then my colleague Simona will begin to collect some of the questions. We don't have a lot of time for questions, so maybe the best way would be to actually write the questions. So let's see how it goes. We have to end by 11:15 because the Commissioner have other things to do. And with these few words, Madam Commissioner, I would like to pass on the floor to you.
Thank you so much. Thank you for the invitation, and it's a great pleasure to be able to join you here this morning. Ladies and gentlemen, at the beginning of every year, we usually all reflect on the past and start planning for the future. And I think that this exercise is especially important this year, although I would add that we are still in the middle of the pandemic. So we cannot really say that we have learned all the lessons. We are still learning on an everyday basis of what we need to do in order to move forward. But COVID-19 has so far taught us already some very harsh lessons, and it has really highlighted the fault lines in our health systems and in societies. it has really amplified the inequalities that we really knew were already there. We have seen especially how vulnerable groups have suffered, and showed that for a long time the tendency was to underfinance and under-prioritize health. And this, I think, is what one of the lessons learned is that we need to strengthen and prioritize health much more. Health today is at the top of the agenda. We need to harness this energy for the benefit of all the citizens. And this requires a multi-stakeholder engagement, something that the European Policy Centre and the Coalition for Health Ethics and Society have been promoting for a very long time. So I'm very delighted to be with you today and have an opportunity to exchange some ideas and share some thoughts with you. The Commission is taking decisive and coordinated steps to end the COVID-19 pandemic, including on testing, on the supply of medical equipment, and on the supply of and access of essential medicines. We are, as I said, still in the middle of the pandemic, but we are starting beginning 2021 with some groundbreaking new tools at our disposal, as you yourself said. Every day, priority groups across the EU are being vaccinated with safe and effective vaccines. 2 have been approved so far, those of BioNTech, Pfizer, and Moderna. And there is light at the end of the tunnel, as more approved vaccines, I hope, will be joining. The European Medicines Agency recently, 9 days ago, received an application for the AstraZeneca Oxford vaccine, and expects to deliver its scientific appraisal at about the end of this month. And we expect to receive more applications for potential vaccines in the coming months. And this is by no means an achievement that we shouldn't all feel is really remarkable. Never before have so many of the world's scientists been focused all together urgently on such a matter. And by working together, the EU has secured a very diverse portfolio of vaccines. Vaccines that save lives, it's vaccinations. And we need to urgently prioritize and speed up the rapid and equitable and effective rollout of vaccines so citizens are vaccinated as quickly as possible. In order to do this, the Commission has been working very closely and continuously works very closely with Member States to both monitor and support this process. But this is an enormous undertaking and involves many challenges, because never before have such a mass vaccination campaign been undertaken at the European level. We have now launched a joint procurement so that Member States can access vital equipment for COVID-19 vaccination. For example, needles and syringes. And testing will continue to be part of our response. Last month, we successfully concluded a contract to purchase over 20 million rapid antigen tests, mobilizing 100 million euro from the emergency support instrument. And we have also presented a proposal for a council recommendation on these tests, because what we do know, and I would think that one of the many lessons learned, is that we need to work in a coordinated and clear approach across the EU. What we saw in the very first few months of the pandemic clearly could not be the way forward. And I'm very pleased that over the last few months, we have been working very closely with all Member States in order to be able to really bring the results that citizens expect from us. And the European vaccination strategy is a true example of solidarity at its best within the EU. Now, ladies and gentlemen, while COVID-19 has brought many difficult challenges, we must grasp the opportunity to put long-term solutions in place. And that would mean that we need to address the weak points in our health systems. We need to address our preparedness and our response capacities. The Commission has proposed a very comprehensive package of initiatives to strengthen these weaknesses and reinforce our health systems. when the crisis first began almost a year ago now, I remember hearing EU citizens' voices saying, "Where is the European Union? We want more Europe in public health." And this is exactly what we're going to try to deliver. We're working to build a strong European health union that is better prepared, that is more coordinated, and more responsive to cross-border health threats and public health emergencies. We are going to make sure that our two EU agencies that have been at the forefront of our work, the ECDC, the European Centre for Disease Prevention and Control, and the European Medicines Agency, have the capacity and the mandate that they need in order to take their place in today's world. And we're creating a new authority. It's called HERA, the
Yeah, I'm sorry, I'm interrupting. Oh, sorry. You just disappeared, Commissioner, but you're back again, so thank you.
Are you there?
We can hear you, Commissioner.
Sorry, thank you. As I was saying, in November, we launched the new pharmaceutical strategy. This was adopted. And we knew for a very long time that there were issues that have to do with the affordability, with access to medicines, and medicine pricing. We launched a strategy that really is our vision, and it will have a number of actions over the next few years to ensure that patients have access to innovative and affordable medicines, and to also strengthen the EU's strategic autonomy and support competitiveness and innovation of the pharmaceutical industry within the EU. Together, these measures will strengthen our health systems and increase our resilience across cross-border health threats, starting with COVID-19. You mentioned the last year when we were together. So much has changed, and I wanted to let you know that on the 3rd of February, this is less than 2 weeks, the European Commission, the College is adopting Europe's Beating Cancer Plan. You're all invited to join in the virtual press conference event of the adoption, which will be on the 3rd of February, immediately after the adoption by College. We cannot all be together, but we can all be together virtually in the launch of the event. So, ladies and gentlemen, I'm very confident that we can exit this pandemic. And once we exit it, we can have a healthier, a more equal and a more sustainable future. But first of all, we need to look back. We need to take a step back and see how we're working together, how we're interacting, and how we're cooperating. We are fighting a respiratory virus in the world, in a world that is choked by pollution. Both our societies and our planets are struggling to breathe. And too many of us are living totally unhealthy lifestyles, and other non-communicable diseases are on the increase. Biodiversity is vanishing rapidly in the face of climate change and environmental degradation. And of course, COVID-19 has highlighted challenges that were already there, such as that of antimicrobial resistance. You mentioned the new ambitious EU for Health program, a budget of 5.1 billion. That is, we had asked for 9 billion. We have now got 5.4, far more than ever, 5.1 than ever was available for a standalone health program. And this is, we really aim to make this make a difference to citizens and to health. The program will support actions on mental health, something which is often forgotten, on chronic diseases, on vulnerable groups, on helping to make the European Health Union a reality, and providing a platform for sustainable change. Farm to fork strategy is a key part of this puzzle, which we have presented, and it looks to building a fair and healthy, environmentally friendly food system, Europe's Beating Cancer Plan, and of course the Green Deal. So while we are in the middle of dealing with the pandemic, I would say that we have gone ahead, and from the lessons learned and learning, we have constantly put forward new proposals, because many of the steps we have taken to deal with COVID-19 cannot be steps taken when you're dealing with a crisis. We need to see what structural changes need to be in place so that we are proactive and able to respond to any future crisis in a far more effective way. And let me finish by stressing an important point. COVID-19 has reminded us on the foundational importance really of our health. But the pandemic has also shown that health cannot be just the responsibility of the health sector. And we need, and this is how we're working, to follow a holistic, a health in all policies, a multi-stakeholder approach. We need to have strong partnerships and collaboration, and to work with everyone, with civil society, with stakeholders, with all, in order to be able to really deliver what European citizens expect from us. Thank you.
Thank you very much indeed for your excellent presentation. There's a lot to be done now, and I think all the efforts there must ensure that this quantum leap that we've got in health policy in the EU is not wasted. We should not waste a good crisis, if you like to put it that way. So we really like to support your work and strengthen the efforts that you're going to do. But that leads me to one question. There's, by the way, another issue as well that we could probably discuss later on, which is the European health data space that might develop as well, and that could help maybe on some of the issues. But if I could just ask you one question now, if you look into the future and the post-pandemic, of the experiences we've got and the money you got in the budget now, what would be the main priorities? Because we should not, some people are talking about, should the EU take over all the health policies in Europe? Of course not. But where are the things that Europe can make a difference, and what should be dealt with at a national and maybe even regional level?
Thank you. Well, I believe that the main priorities are already what we have stated. The main priorities is moving ahead with the European Health Union, is the implementation of the actions in the pharmaceutical strategy, the building up of HERA as an authority that will help us deal with cross-border health threats. Cancer within the Europe EU for Health program. Cancer goes horizontally across all the actions, so there will be a significant effort there. And what I believe that we need to do is, we're definitely not going to be, health is member states' competence, and this is not going to change. But well within the competence that we have through the treaty, we are able to change substantially the way that we are better prepared and equipped and prevent, manage a health crisis. And the cancer plan, the pharmaceutical strategy, HERA are all pillars of a strong European Union for health.
Sure, the health policy is a membership, or well, member state competence, and sometimes even regional, as I think I said. But we have in CHESS, but also I have personally been very strongly advocating over the years the comparisons between, well, the benchmarking actually of health systems in the sense of learning from each other, because I think there's still a long way to go. We have health at a glance. I think we have this whole process with the country reports and the companion reports coming out in the autumn and so on. But what is your attitude to this issue about learning from the best practices? Is it something we should strengthen, and how do you think that member states look at this?
Well, it's all about working together and coordination, and you need to learn from best practice at all levels in order to be able to move forward. And this is an integral part of the way we work, is exactly using all the synergies in order to be able to move forward in the right direction. So we have seen from the pandemic, especially the weaknesses and shortcomings that we face with cooperation and coordination at the EU level in the area of health, especially in the first months. But we also saw how we can work together and learn from each other and really put best practice into action, which I think this is the most important thing. This isn't, as you said, about taking control of the health policy, but it's to work more closely with member states and to enhance the EU's capacity to support member states through sharing best practice in future crises.
Yeah, let's hope people will look over the silos and into other silos to see if there are things that best practices that you can emulate. That is a good way to make the system more resilient, I think. So thank you very much for that. I also think that we have Stella Verkauteren, who is director at Johnson & Johnson, who would like to ask a question to you. Stella, are you online? Might take a second or so. I see his name is coming up. And otherwise, for the rest of the audience, if you could, yeah, please.
Yes.
Please prepare some written questions. Sega?
Hi, do you hear me?
We hear you, but we don't see you. But
okay.
but
I will try to solve that as well in our technology world. So
otherwise,
yeah,
we hear you. So
shoot ahead. But thanks a lot, Hans and the EPC, for allowing me to join you for the Q&A. And Commissioner, first of all, congratulations and a big thank you, acknowledging really the hard work that you have put into this. Not only the crisis, but already from the first started to work into this to really give the filling in of your role and the role of I mean, the European Commission and the European institutions with regard to health, to the expectation of European citizens to give that a differentiated approach than what we have seen before. And we were all obviously conscious of the limits of the subsidiarity, but you have also shown that within the current framework, there is a lot possible. So I want to introduce myself. I'm Stella Verkauteren, and I'm leading government affairs and policy for Europe, Middle East, and Africa, as well as for global supply chain in Johnson & Johnson. And you know, J&J is one of the largest, most comprehensive healthcare companies, and we have been in Europe for about 100 years. And we employ about 40,000 people over 78 sites. And it's in Europe that we are developing our lead candidate for a single-dose COVID vaccine, as you well know. But as a company, people's health and well-being are really at the heart of everything we do. And we believe that health comes first and everything else follows. We see health as a lifelong investment and a key driver for economic, but also social well-being. And so that's very much in the light of what I would say the One Health vision championed by you and the Commission in its plan of the European Health Union. So this kind of really holistic and intersectorial health in all policies, as also Hans and yourself talked about, seems especially crucial and urgent now that the pandemic has made such a devastating and unescapable impact on every dimension of our livelihood. So my question to you today, Commissioner, would be how you mentioned about reforming healthcare systems, and so how do we best collaborate with the reform of the healthcare system moving out of the pandemic? Where is collaboration especially needed, or where would the Commission like to see partnerships and collaboration that could have also the private sector being part of this? And then specifically about HERA that you mentioned, it was often in the beginning quoted as the European BARDA. Obviously, the US is one country and has other, systems, check and balances in place. We have a very particular context. How do you think that we can reach in a European setting with 27 countries, with the authority we have, our budget planning and so forth, an as effective instrument for the European Union? Thank you very much, Commissioner.
Thank you, Stella. Madam Commissioner.
Thank you. A pleasure to meet you, even though online. First of all, I have said that I think that we're in a position now that together with member states, we need to really re-examine health governance. And I hope that member states will agree to the changes that we're proposing in the Health Union package. As I have said, it is important to understand that this package is well within the boundaries of the treaty on the functioning of the European Union. And this isn't about taking control of the health policy, but to work more closely with member states and to use our capacity to support member states. We need to become more resilient to future shocks. And this is what we want to achieve within the current competencies. And this is the whole point of HERA. A strong HERA with sufficient budget and competencies would be the first operational step towards a better preparedness and sharing competencies at EU level. We have also seen that we need a higher level of coordination and cooperation, and this is the proposal behind the European Health Union, because in this way we would be able to strengthen our economies and our societies, because as we have seen, what people have not realized, I think, is that where our health is in danger, our economies are also in danger. Now, the last issue that I just wanted to touch upon is that I believe that we have now reached a point when there is an understanding of the level of and degree of cooperation we need to work towards. And I definitely don't believe in working in silos. There is a need for everyone to be on board in this process. This is why we have very broad consultations with stakeholders, and of course the private sector would be involved as well, so that we come forward with proposals which are really going to be as resilient as we want the health system to be in the future. We are at the beginning of this process, but we now have the ability through EU4Health to be able to move and to have also the substantial budget support in order to achieve this. Thank you.
Thanks a lot. You're on mute, Hans.
That's the new black, unmute. Okay. Besides resilient, yeah. But thank you very much for the answers to the questions, but also for the things you mentioned. We have a steering group meeting for the program of next year in Chess this afternoon, and I think quite a number of the things, including the issue of keeping the inequality at a distance, is a very important thing. Also, as we go forward with more digitalization, maybe of the health system and so on and so forth. So that's also why we underline very much here in Chess that we work on a multi-stakeholder basis with input from all the stakeholders around. And they will also be present for the meeting we have this afternoon. So maybe we can have some events there that can also support the work that you are going to do in the next couple of years. And thank you for that. But Simona, can I ask, are there any questions coming in on the chat side?
Thank you, Hans. Thank you. Yes, I'm starting to collect some questions. There is one from Stefan Joris, for example. Among the things that the commissioner mentioned, she focused a lot on the need to improve accessibility. The question is, what would this, how can this be translated into a concrete policy? What are concrete measures that we can take to improve accessibility?
Yes.
So will we be taking one question at a time?
But we can also, can you maybe, Simona, able to...
Yes, sure.
Go with your couple, yeah? Go on. Simona?
Yes, so there is another question on how does the Commission work to broaden the scope of the vaccine strategy to also include other types of treatment, providing an active response to a potential third and maybe a fourth phase of the pandemic. We don't really know where we are going to. And maybe one last question, it's on health security approach. So a lot of the foundation of the European Union Health Union is based on the health security approach. Commissioner, would you be concerned with a future fatigue with this health security approach in the European Union?
So, Madam Commissioner.
Yes, thank you. First of all, for your first question, as I said, we put forward the pharmaceutical strategy in November. The issue of, for example, the shortages of medicines, the access to innovation, the accessibility, the need to look at market failures, and is something that we'll be working on within the pharmaceutical strategy. We need to give incentives to companies to produce in Europe. We need to diversify our sources of supply, and we will be looking to reform our pharmaceutical legislation very quickly in order to enhance the incentives for innovation, affordability, and access. Let us understand, though, that the pharma strategy that we presented is a vision, and it's an action plan for the coming years. So that is how that we will be moving to there. For the vaccine strategy, I believe that the way we have moved, this is an example of real European Union solidarity. We have with 27 member states managed to now secure a portfolio of 6 potentially successful vaccines. We have 2 vaccines already being rolled out in member states. We have the AstraZeneca vaccine, which has submitted for authorization, and we're hoping that more will follow in the coming weeks and months. So this has shown the strength and really of working together. And this is a huge, of course, task, and we're constantly working with the companies as well in order to help them expand their production capacities. We're already there to help expand production capacities, and this is also part of our strategy. So in June, all 27 member states agreed with the Commission that we shouldn't put all our eggs in one basket, because this would have left member states at a risk of ending up without an effective vaccine. And this approach shows the importance for myself of collaboration, and it shows what we can do working together in the future. And on health security and resilience, this is all going to be looked at in HERA. We will be coming forward with a proposal for HERA at the end of 2021. Thank you.
Thank you. Do we have more, Simona? Or?
Yes, thank you, Commissioner. I'm receiving other questions. In particular, one of the lessons learned is also the strong link between health and the economy, between health and economic growth. Commissioner, could you maybe elaborate on how the Health Union and the proposals, the pharmaceutical strategy can support European recovery? This would be one question. And another one, are you aware whether member states have decided to give up parts of their pro rata quota of the vaccines? And I think the question refers to EU solidarity with neighboring countries.
Yeah, and the rest of the world, maybe we can add to that. So thank you for the question, Simona. Madam Commissioner, please. You are unmuted, I think.
Unmuted. For the first question, well, I think in terms of the pharma strategy, I've already picked up on that and answered that. This is a vision. There are actions that are going to follow, and we will be coming up with proposals over the next months and years, but we are really looking towards revising the pharmaceutical legislation in order to be able to deal with the many problems. Let me just say here that the pharmaceutical strategy was not a result of COVID-19. This was already in my mandate from when I became commissioner in December. So there was already a realization in member states that there were issues that really affect access to medicines of patients in terms of affordability of supply chains. And we were already going to look at that. What COVID-19 has done is really brought to the fore, accentuated the magnitude of the problems. So I would say that there. And in terms of the question on Europe and the rest of the world, we're dealing with a pandemic. And in a pandemic, no one is safe until everyone is safe. And this has never been about Europe first or only Europe. So we have been working very closely with WHO. We're a major supporter of the COVAX facility with over 480 million euro. We're possibly the biggest supporter, which aims to provide access to safe and effective vaccines to other countries outside the EU. This needs to be understood, and it's crucial that we do work, and we're looking at supporting this through COVAX and also asking member states if they are able to have a sharing mechanism with our neighboring countries. And the importance of this is not only to show solidarity, but if you look at the ongoing evolving situation with the variants, you can understand that if we only focus on vaccinating the population within the EU, when you have a situation of evolving in other countries, you are not going to be able to deal with the pandemic effectively. So we are very committed to the global role of the EU in terms of tackling this pandemic. Thank you.
May I just give you a very easy question? Is it good or bad news that the US in this context is coming back to the WHO? That was the easy part. But when I know your answer, will there be a chance, to have a common and a joint strategy for these matters in the coming years?
We have been working with the US with the previous administration as well as part of the G7. I follow the G7, and the US, of course, is a member of the G7. So we have been already working together with them. Of course, I welcome the decision that I saw of the new administration to come back into WHO and supporting COVAX. I think it's very important. We cannot deal with global pandemics if we don't work all together. So I look forward to working with the new administration.
I was sure you would be. I think we are approaching the final series of questions, so I want to go back to you, Simona. I just have one little question here about this question of health and all policies that we discussed before. So in a way, the causes of bad health and so on can be looked upon from outside the health system, coming from environmental, from transport, from social conditions, from many other areas. But do you see a way that you can basically get away with crossing the silos within the European Commission and make other parts of the Commission realize how responsible they also are for health policy and needs to work in the same direction? We have every year kind of a discussion about health and all policies, and this is an issue that has always come up because the Commission has its own silos as well, I think I'm allowed to say. Simona, were there one or two extra questions that we could put in now?
Thank you, Hans. Maybe one last question for the Commissioner. If she could tell us about the Commission plans on mental health. The mental health strategy was somehow planned, suggested at the December 2019 Council. What's the plan with that? Do you think this is something that can be taken on during this pandemic, or maybe it should be something for post-COVID era?
Thank you for both of those. First of all, let me assure you that the Commission does not work in silos. The pandemic has really shown us the importance of working together. You cannot work in silos when you're dealing with a pandemic, and you can and health goes horizontally across many of the portfolios of all the other commissioners. So in the cancer plan, there are, I would say, I don't know how many to count, a number of other commissioners who are all involved in the Europe-speaking cancer plan, for issues to do with employment, to issues to do with environment, from issues to do with equality. So we are already working across and horizontally, and this is the way we intend to work. When we're speaking about One Health, you need to involve everyone together, and this is already being done. Also, I would just 2 words on the mental health strategy. Mental health, it's also an area that has been my professional life. I feel that we need to do a great deal more. We are presently working on this. We have not stopped working in parallel with all our other priorities due to the pandemic. So Farm to Focus presented in May, the pharmaceutical strategy in November, the Beatings Cancer Plan will be in February. We're working on the European Health Data Space, and we're working on the mental health strategy. And with mental health, what I would tell you is that I think COVID-19 has catapulted mental health issues into the forefront. I have had the opportunity to speak with a number of stakeholders, of families, of those with mental health issues and others, and really they are dealing with multiple challenges. And we have provided a platform for them to be able to feed in so that they can receive support and help. Thank you.
Well, thank you very much, and also thank you for addressing the issue of the silos. I didn't want to be a naughty boy this morning, but I just wanted to mention that this creates a new demand for cooperation from different sources, also within the Commission, as you were saying. So thank you very much for your answer to that. And also the assurance that you will work together from the different areas.
Yeah, we are working together. We are working together.
Also to reinforce, of course, the fact that we now have health as a very higher priority than we used to do in the Commission. So, but thank you very much for your excellent, not only presentation, but also for answering all the questions. Let me also thank you for the excellent work you've been in this position for a little bit more than a year now. A lot has happened in the meantime, and it was probably when you took the job a situation that you did not foresee, but you've done it really well, and I think placed the EU clearly on the map in Europe. So I'd like to wish you good luck with the future. We would also like to address issues that we talked about today in our health program, as I was saying, in the work program for CHESS, and maybe get you and some of your colleagues participating, and maybe give a good multi-stakeholder input in support of the development of the EU for health.
Thank you so much for the opportunity. Yes, it was 1 month after I stepped into the position of Health Commissioner. It's not that I couldn't have envisaged this. I don't think anybody in the world could have envisaged this.
No.
And there are going to be multiple challenges all the way, but all we can do is really give it our best and problem solve so that we find an exit to this situation. And I very much look forward to welcoming you to the Berlaymont, because teleworking is great, but I'm very Mediterranean, so I look forward to face-to-face meetings.
Yeah, but I look forward to that as well. So
thank you so much for the opportunity.
Thank you very much indeed. Thank you.
Thank you.
And thank you for all the participants for listening in and for all your good questions. See you at the next